This is the MRO Minute, where we provide an in-depth review about specific drug testing issues, brought to you by Central Drug Testing. I'm Dr. Schwartz. I'm a medical doctor and a certified medical review officer. Today we'll be looking at the negative dilute result, what it means, and how a company should respond to it. After a specimen is provided, there are several tests done to evaluate the sample in order to prove that it is indeed human urine. This is called validity testing. Over the years, the labs have worked to help determine which results are medically acceptable versus when a donor has specifically tried to alter the sample. Although there are different types of validity tests, the two that are used to evaluate for dilution are creatinine and specific gravity. Creatinine is a product of muscle metabolism and is produced at a fairly consistent rate. Ingestion of creatinine supplements or protein shakes have not significantly affected the levels. Urinary creatinine levels serve as an indicator for urine dilution. Normal levels are usually above 20 milligrams per deciliter. Physiologically, it's rare to get below 5 milligrams per deciliter, but it's never normal to be less than 2. The specific gravity is a measurement of the density of a fluid in comparison to water. The specific gravity of water is measured to be 1.0000. The specific gravity of urine is more dense than water, and it's normally between 1.0030 and 1.0300. When substances are added to the urine, such as proteins, sugars, and dyes, it increases the specific gravity. When water is added to the urine, it decreases the specific gravity. This slide, along with the next one, shows the difference between a dilute versus substituted urine. Dilute is when the creatinine is low, but it could still be physiologically normal. Even though 20 milligrams per deciliter is the cutoff, it can occasionally be lower than that, but never lower than 2. In practice, tests are often scheduled in advance and donors are told to bring a full bladder, so it's not uncommon to see a dilute result. In fact, studies have shown that 5 to 7% of results are dilute. A substituted result means the specimen received by the lab was not urine. After the lab evaluated the creatinine and the specific gravity, they're found to be outside the ranges normally produced by the human body. This will be discussed much further in a different video. The medical review officer will report a dilute specimen by checking the dilute box on the MRO report form, along with checking either the positive or the negative result. Many times, though, when the drug screen is positive, they may not check the dilute box as well. However, when the test is dilute negative, they will check both the dilute and the negative box, and they should write the creatinine and specific gravity results in the remarks section. Sometimes the medical review officer will use the medical abbreviations for these. CR equals creatinine, specific gravity is SG or SPGR. As an employer, the creatinine level should determine what you do. Remember that with lower creatinine levels, it becomes less likely to be a normal result and more likely to be a substituted specimen. There are no disciplinary actions recommended besides possible recollection of the sample. Depending on how close the initial test was to being incompatible with human physiology, it may trigger the retest to be done under direct visualization. So with a creatinine of less than 5 but above 2, since that's substituted, and a specific gravity within this range, the employer should retest under direct observation one time. However, if the creatinine is above 5 but less than 20 and the specific gravity within these ranges, the employer has the option of immediate retest, but does not trigger a direct observation test. So just a quick review, dilute negative is not an indication of misbehavior. A creatinine below 5 but above 2 milligrams per deciliter should trigger an immediate retest under direct observation. A creatinine below 20 but above 5, the company has the option to retest, but not under direct observation. In this second scenario where the creatinine is low but not as close, it is up to the company to make a policy about what to do. The most important thing is to be consistent. This is where liability can occur. That's the end of this video. Please leave a comment or reach out to us at centraldrugtesting.com.